How do arthritis scans show active inflammation versus structural damage? Imagine trying to fix a broken pipe. You need to know if the leak is still happening or if the pipe is just old and cracked. That's similar to what doctors do with arthritis scans. They look at joints to see if inflammation is active or if the damage is just from past problems. Different imaging tools help them see these two things clearly. When inflammation is active, the body shows signs like swelling, excess fluid, and increased blood flow. In the joints, this can mean synovitis, which is inflammation of the lining inside the joint, or joint effusions, which are collections of fluid. Tendon sheaths can become inflamed too, called tenosynovitis, and bursae, small fluid-filled sacs near joints, can swell up. Sometimes the bone marrow inside the bones shows edema, which is fluid buildup indicating ongoing inflammation. Magnetic resonance imaging, or MRI, is especially good at catching these signs. It can show thickened synovial tissue that lights up after a contrast dye is injected. It also reveals fluid in the joint space and bone marrow edema, which is a clear marker that inflammation is still active. Ultrasound is another helpful tool. It can detect increased blood flow in inflamed tissues and visualize swelling or fluid collections around the joint. Ultrasound is quick, portable, and can be used during a physical exam to see real-time inflammation. On the other hand, structural damage shows the long-term effects of past inflammation. This includes cartilage loss, which makes joints less smooth and causes pain. Bone erosions are areas where the bone has been worn away, and these are visible on X-rays and computed tomography scans. Bone spurs, called osteophytes, can form around the joint edges, and tendons might tear or become damaged. These changes are usually permanent and indicate that the joint has undergone degeneration over time. X-ray images are great for spotting these long-term changes. They clearly show bone erosions and narrowing of the joint space. Computed tomography scans give a more detailed view of bone damage, especially in complex areas. Magnetic resonance imaging can also show cartilage loss and bone erosions in detail, giving a full picture of both soft tissue and bone damage. MRI is unique because it can display both active inflammation and structural damage in multiple planes without exposing you to radiation. Ultrasound helps by showing inflammation in real time and soft tissue involvement, which is useful during examinations. X-rays are best for monitoring long-term damage but are less sensitive to early signs of inflammation. Understanding the difference between active inflammation and structural damage helps doctors decide how to treat arthritis. If inflammation is still active, treatments can often reduce or reverse some damage. But if the damage is already done, the focus shifts to managing symptoms and preventing further deterioration. Early detection with these imaging tools can make a big difference in how arthritis is managed and how well a person can keep their joints healthy.